Hi, everyone. We're just going to wait a moment while everyone has the opportunity to sign on. So please just bear with us for a moment and we'll get started soon. Good turnout so far. This is great. All right. Well, that number has kind of stabilized a bit more. So I'm assuming that everyone has had the chance to log on at this point. So hello and welcome, everyone. Thanks for joining us today. I guess just to note, we are recording this session currently. So if you do need to log out before the end, we're going to make sure that we send this recording to you within the next week or the next couple of days so you can listen back at your own time. But without further ado, I guess we can start with some introductions. So my name is Hannah Campbell. I am a Senior Assistant Director of Admission here at Massachusetts College of Pharmacy and Health Sciences. And I primarily work with our applicants to the Doctor of Optometry program, which you've attended this session because you likely have an interest in our program. I'm also joined here with a couple of our current students who I'd love for them to introduce themselves. So why don't we start with Shelby, then Dhruvi and Dalasha, if you guys don't mind.
Yeah. Hi, my name is Shelby. I am a third-year student, my first semester of third year. I'm originally from Jamaica, but I was in Canada for a little bit, and now I'm here. So I've been around a little bit. So, yeah.
Hi, everyone. My name is Dhruvi. I'm originally from India, but then I moved to Edmonton, Alberta. And currently I'm in my first semester of my second year.
Hi everyone, my name is Dalasha. I'm also a second year student and I am also originally from Nepal, but I moved to Canada when I was very young. So I'm from Edmonton, Alberta. I think I saw someone that had an area code that was from Edmonton, but if you are, welcome. Thank you for attending.
Yes, welcome to attendees from Canada and beyond. We're happy to have you here. And we also are joined with one of our faculty members, Dr. Beish. Would you like to introduce yourself?
Hello, I'm Dr. Larry Baich. I'm a professor and associate dean of research here at MCPHS University. And I'm from a different country. I'm from Texas. So I welcome you all and hope you enjoy this session.
Awesome. Yeah, we're all pleased to be here to talk to you about our School of Optometry here at MCPHS. So during this session, we'll talk a bit about the university, our program, how to apply, and then we're going to finish up with a Q&A session to answer any last questions that you may have. So as we're going through this presentation, if you do have any questions, you can feel free to leave that in the Q&A box on the corner of your screen, and we're happy to address that at the end of the presentation. So let's get started. So just starting with some basic information about MCPHS, if you're not familiar with us, we are a healthcare specific university, and we have over 100 programs in healthcare and the health sciences. So that is really our specialty here. We started as a pharmacy school in Boston back in 1823. So in that 201 span of years, we've seen quite a bit of growth. And now we have 3 physical campuses as well as a large catalog of continuing education online programs. And many of our faculty do work clinically in addition to being faculty in our various programs. So they're up-to-date, active providers, able to bring the current trends and new technology and such to the classroom with them. Nowadays, we have over 8,000 students between our 3 campuses and our online branch, and we do really pride ourselves on maintaining some clinical affiliations with some of the leading medical institutions in the nation. So when you do have your opportunity to pick your externship sites, you're really going to have no shortage of options. Currently, we have sites that are as far west as California and even rural Alaska, as far south as Texas and Florida, and really everywhere in between. So we'll talk more about that as we go throughout the presentation. So here's a bit more information about our various locations. So like I said, we started in 1823 in Boston. Then our Worcester campus was born in the year 2000 and Manchester shortly after in 2002. So while our Boston campus is primarily our undergraduate campus, we do have a couple grad programs there, but the majority of our graduate programs are going to be found on our professional phased campuses in Worcester and Manchester. So there you'll find students that are working on a specific professional phased healthcare careers, such as optometry for our Worcester campus. And in addition to that, you'll get the chance to be around students in interprofessional education environments, which we'll also touch on shortly as well. And then in addition to that, we have our online catalog of some various continuing education programs. So some of our students may go on to pursue a Master of Business Administration and Healthcare Management if they're looking to open a practice of their own. We also offer like a Master of Clinical Research if you want to go into clinical education or whatnot. So there is a lot of other ways to supplement degrees through various online programs, as well as a nice alumni scholarship that can be used to supplement those as well. So talking a little bit about our Worcester campus, where our optometry program takes place, that is how you pronounce that word, is Worcester. Although if you speak to a local around here, you may hear it referred to as Worcester, because in Massachusetts, we often drop the ER and add an AH. So that is not going to be uncommon to hear from time to time, but we are very much so in the metropolitan Boston area. So only about 45 minutes or so outside of the city of Boston, as the second largest city in New England. And there's healthcare all around us here in this city. Even visible from our front steps, we have St. Vincent's Hospital. And then just down the street is UMass Chan Medical School, which we have a great partnership with, given that they have an ophthalmology program. There are also 11 other colleges and universities in this city. So I do like to say that our MCPHS students tend to stick out like a sore thumb, as you can kind of see from this photo here, as they're often downed in their white coats. So you can pick us out of a crowd pretty easily. But in terms of the city itself, it's really well known for the entertainment that comes through the city. So our campus is actually in the downtown area, and it borders a lot of these well-known venues for entertainment, including the Hanover Theater, which you can see a Broadway show, Mechanics Hall if you want to see a symphony orchestra, the Worcester Palladium if you want to see a indie band, as well as the DCU Center, which has bigger touring artists come through. I've even seen like Cirque du Soleil come through, and only a couple weeks ago they had WrestleMania or something like that. So there's always something fun coming to the city. And the DCU Center is also where our hockey team, the Worcester Railers, play. And we also have a baseball team, the Worcester Red Sox, which is the minor league affiliate of the Boston Red Sox. So there's a lot of fun things to do in this area. But I will pass it off to our students to see if they can tell me what they like to do in their free time. I know they don't have a lot of it, but what do you guys like to do when you do happen to have a bit of free time to wander around the city and whatnot?
I like to visit the different restaurants around because I feel like there's so many around, even just walking distance, like less than 10 minutes. But there's also some that you can drive to as well. But I feel like just walking around outside of campus, it's easy to find a restaurant, and there's lots of different foods that you can eat. There's Jamaican restaurants, so it's always good to go there because I'm Jamaican as well. So a little bit of food from home, but there's also African restaurants, Indian, Italian, you name it. So food is a big thing for me. So that's what I like to do around here.
Great, thank you, Shelby.
Food as well, but there are lots of like escape rooms, like painting sessions, like shooting ranges and stuff. Lots of activities to do around the campus as well.
Thank you, guys. That's one that I hear a lot. I know you don't have a ton of free time, but you always have time to eat, right? So most of our current students like to enjoy some local cuisine within the city, and we are a very diverse city at that. So luckily there are a lot of diverse food options that come with it. Now, I know that all of our students here, as well as Dr. Beish, are kind of transplants to the city of Worcester. So how has your experience been living in the city? Don't all jump in at once, guys.
I'll volunteer this one. My intention was just to come here for a little while because being from Texas, I hate cold weather. But it turns out that, in fact, I was only supposed to be here for about 2 years. But my wife and I really fell in love with Worcester and the area, and I fell in love with the university. And we're here to stay. We're in our 8th year now, and we've got a house. And one of the things I really like about Worcester is that when we first moved here, we said, well, you know, it's a college town, but if we want to do something, you know, really unusual or fun, we'll go to Boston. It's only 45 minutes from here. I can tell you that it's only been a handful of times we've been to Boston over the years. Everything you could possibly need is here. It's a very friendly, easy town to live in. You can get out of town if you want. If you like the outdoors, you can be out of town in 7 minutes rather than 2 hours. And you know, you're 45 minutes away from the top of a mountain and 5 minutes away from biking trails, and it's just a really easy and place to live. And then the populace is very educated, and as Hannah said, there's 11 colleges and universities around here, so it's you know, the social life for young people is tremendous.
Awesome. I think you captured all the great features, so thank you for that. One other unique feature that we can offer to our students is on-campus housing. So this is pretty big for a graduate program to be able to offer. So we do have a pretty mature population here on our Worcester campus, given that these are all professional-phased programs. So everyone has a bachelor's degree or a significant amount of transfer credit, you know, junior, senior level status for depending on the program that they're coming in, because some of them do require a bachelor's degree, as well as some of them might be more of a transfer focused program like dental hygiene or diagnostic medical sonography. So with that, it creates a really focused professional campus environment. And we do have students that come from all over the world, as you can see from our population today that are joined with us. So it is nice to be able to offer housing as an option, given that it's one less thing that you have to worry about, you know, finding a place to stay as you're moving across the country to join one of our programs. So with that, we have 5 different residential options, ranging from studios all the way through multi-bedroom apartments. And no matter where you choose to live, you're going to have your own room. So you never have to be in a forced triple like your undergraduate experience might have been. You do have the privacy of having your own bedroom space. In addition to that, all utilities are included in the cost of rent, and units do come furnished. Now, I would love to ask Delasha in particular about what she likes about living on campus, given that she's actually one of our resident assistants this year.
Yes, so I am currently an RA in the same floor that I was a resident in. So I lived there for about a year, so I have both perspectives for you. I live in one of the studios at Lincoln, which is our main academic building, especially for optometry. And it's basically a hotel style. It's basically a hotel room. The only thing you don't have is a kitchen. You have to share a community kitchen that's on the 9th floor of the building. But you get your own room, you have your own bathroom, you don't have to share space with everyone. That's the really good thing about Lincoln. But that being said, for our on-campus housing, there's options for everything. So if you have any sort of preference, we probably have it available in at least one of our on-campus housing. So there are options where you have studios with kitchens, there are studios without kitchens, there are 2-bedroom apartments, 6-bedroom apartments, there are 1-bedroom apartments. There are town style, like townhome style apartments. There's everything that you could think of. So depending on what your budget is and what your needs are, we can probably find something really great for you. And another thing about on-campus housing is that the safety is unparalleled. So if that's a concern for you, especially coming into a new city, if you're coming from a state that's far away, or if you're international like myself, my parents really valued how safe the on-campus buildings were. So that's also something to consider. But yeah.
Great. Couldn't have said it better myself. Thanks, Delasha. So here's a little bit more about the community that we have here at MCPHS Worcester, with a snapshot of all the different programs that we offer here alongside our optometry program. So, with being a healthcare specific university, we have our advantages. So with representation from physician assistant studies, physical therapy, occupational therapy, diagnostic medical sonography, dental hygiene, pharmacy, nursing, and even acupuncture, we have representation from both Western and Eastern medicine. So while you're not going to share classes with any of these programs, we do frequently come together for interprofessional education, or what we call IPE. So at least once a semester, students get to participate in an IPE activity with students in these other programs. It's a really great way for them to learn about other healthcare professions and how they can work together with patients from different cultures and backgrounds, and ultimately how to work as a team once they are employed in the healthcare system. So in the US, our healthcare system is often described as fragmented or disorganized or uncoordinated. So this is really our effort to alleviate this for the next generation of healthcare leaders, which is why we've really made IPE a part of our mission here at the university. So today, if you're dealing with a major medical issue, you're typically working with a team of medical professionals, which is really why we're trying to instill this interdisciplinary collaboration early on into your career. So for example, as an optometrist, if you have a patient who has low vision, it's very likely that they're also working with an occupational therapist. So at least while you're with us, you're going to be able to get exposed to the work that an OT does and hopefully feel more comfortable collaborating with them in the future. So a couple of examples of what we've done for IPE events. We've done an emergency medicine Narcan training. We did a dementia simulation, as well as a diabetes maintenance training. All of this kind of around the idea that no matter which profession you're a part of, you are going to be working with patients who've maybe struggled with addiction, or who have dementia, or who have diabetes. So it allows you to understand from your own perspective how you can best support these patients, and how your colleagues from these other professions are also able to contribute to your patient's overall wellness. So I want to ask some of our students if you guys can share your experience in these different IPE events that have taken place over the last couple of years. I might have stolen some, so I apologize if that's the case.
I remember the IPE experience that I had. It was about administering Narcan, and previously, before that, I didn't really know much about administering Narcan. I didn't think that I needed to know. But then after the event, I realized that as a healthcare provider, like, it is something that we should know, even though we're doing optometry all about eyes. Being able to say that, okay, now I have some knowledge about how to administer Narcan, because what if I'm seeing a patient or their family member that's there with them happen to have an overdose? I could feel confident in administering that Narcan. So it was a good event just to widen my perspective on things. So I really liked that aspect of the IPE. Like, it's something to take away from a broader perspective, as opposed to just thinking about eyes all the time. So yeah.
Absolutely, it's an excellent point. And anything from Dhruvi and Dalasha? Did you guys have any cross collaborations with any programs over the last year?
Yeah, so recently, as Shelby mentioned, we actually did the Narcan training like a couple of months ago, and it was very interesting to see how different programs handle different situations. But like the general idea of it was to like make sure that your patient is healthy and then like recovers smoothly. So it's just a really nice place to come together and learn about different programs and how that fits into like patient's recovery journey.
Absolutely. And I'm sure there's another IPE event coming down the pipeline, given that the fall semester only just started. So it's always exciting to see what they come up with. All right. So
If
getting on
if I can interject about IPE, if you don't
Sure.
mind.
Yeah.
We also have experiences for people in the different professional programs. For example, we have the physician's assistant program. They come into the clinic, and the students actually teach them how to use a biomicroscope, So if say a PA is working in an emergency room or a health clinic, they know how to look at the eye properly and how to diagnose disease or how to triage trauma. And so that type of cooperation is very common and increasing. Our IPE programs are sort of accelerating. In addition, we're developing IPE clinical programs and instructive programs. For example, we just completed arrangements for occupational therapy to do cooperative projects with optometry, and especially in the area of low vision, where occupational therapists and optometrists get together and they take care of patients who have had either trauma and have vision loss or eye-hand coordination problems. And so we're about to start a big program for that. That's going to be commencing actually within the week. So programs like that are continually developing. Physical therapy and optometry, where a patient who's had trauma or again a stroke may have not only walking problems, but they may have vision problems, and we all coordinate as a team to help that patient.
Thank you, Dr. Beisch. This is why I always like to have you as part of these info sessions, because even I learn new things that I didn't know about. So that's great. That's really exciting. I'm excited to see how that comes to fruition pretty soon. All right, so now I want to kind of talk specifically about our Doctor of Optometry program, the program you guys came here to hear more about. So of course, we launch a new cohort every year, each September, and this is a 4-year program. We do really pride ourselves on having some small class sizes, given that our faculty are able to provide a lot of individualized attention to our students. So here our cohorts are just about 64 students, because that breaks down nicely into 16 students per lab. And I do want to make it known that you're not just another name on a roster, as cliche as it is to say, but our faculty really do go above and beyond to get to know you past, the first name basis, really understanding, who you are, where you come from, what your passions are, what you're looking to achieve within this program. So if you do have the opportunity to come visit us in the future, we'd love to show you around, and hopefully you'll be able to witness our community for yourself. So this is a really close-knit, small community here at MCPHS, and it does have the great opportunity to give you a Master of Public Health alongside your optometry degree if you do want to pursue that. So it's a sort of a buy one, get one deal, and you can do that starting in your 2nd year, and it adds just one additional online course to your curriculum. So with that, it's an asynchronous course through MCPHS online, and you do usually have until Sunday at midnight to submit assignments. So it gives you the opportunity to put your optometry studies a bit ahead of your MPH studies, and maybe finish up the weekend with whatever else you had for work to complete. So it's a great credential to add to your tool belt, especially if you're looking to go into education or access and advocacy. In addition to that, I want to point out some of the statistics at the bottom of the slide here, just regarding our residency match rate. So most recently, we've seen 25% of our optometry students match with an optometric residency. So of course, residency is optional. Not everyone chooses to pursue one, but it is an excellent opportunity, especially if you want to work in a specialty or teach, because it really hyper accelerates your resume and gives you an advantage out there in the workforce. So we've consistently been above the national average at that residency match rate. And we like to say that it's because we have an extremely comprehensive clinical education here at the university. So our students are seeing patients much earlier than other programs. In fact, they start seeing patients as early as their 2nd year, first semester of 2nd year. And before that, they get a lot of exposure to our clinic all through 1st year. And our diverse patient population also contributes to that as well. Worcester is a sanctuary city, so we do have a lot of refugees and immigrants that come into the city, ultimately looking for healthcare services, and might find themselves here at MCPHS with some of our students. So with that, our students get exposed to a wide range of ocular disease and different pathologies that might only be common to certain areas of the world. So it does a great job at prepping them for what they might encounter in their career. as an optometrist. So with that, I want to give you guys a breakdown of what you can expect year to year in the program. So Dhruvi, would you mind taking us through year one of what students will expect to experience as a first-year student?
Yes, so first year is really a foundational year. You spend a lot of time in classrooms and labs learning the skills you will use in your second years when you start seeing your own patients. For first year itself, we also get clinic exposure really early because as soon as like second semester comes, we get to observe upper years in the clinic with patients and how the clinic aspect of things side work. And also we rotate through optical, so that's our like glass shop. And like it's really amazing to know what they do in their everyday life and like what we will be doing in our second year.
Fantastic. And new to first year that we actually just launched this fall is Jumpstart, which is a six session program that equips new students with the tools that they need to be successful and to give them a smooth transition into the curriculum. So we're excited to launch that this year and are hoping that it just makes our students feel more prepared as they move through each of the semesters ahead. And Delasha, would you take us through year two as a newly dubbed year two student?
Sure. So we just started clinic actually in the real clinic where real patients come in, and we started seeing real patients this week. So we are in primary care clinic for our first semester, and then our patient exposure gets kind of more and more as we progress through second year. And then obviously in third year, we're seeing a lot more patients, but we are not only in our eye and vision center, like downstairs, literally, but we also go out to vision screenings and we are doing shifts in the optical. So now we're like really gearing up and getting into real patient care, which is really exciting. But I think at MCP, you get exposed to clinical skills like really, really early, which is one of the really good things about MCPHS. So yeah.
Great, thank you so much. And Shelby, would you take us through year three?
So year three is basically like year two, but times 10. So you get a whole lot more patient experience or patient encounters. You're doing eye exams, I want to say about 2 days out of every week, but it rotates as well. So depending on what specialty you're doing that semester, like for myself, I'm now in contact lens clinic. So I'm also focusing on the contact lens aspect of the eye exam, while some of my other classmates are doing glaucoma eye exams or pediatric eye exams, and that rotates. So next semester, I'll be doing pediatrics and glaucoma. So there's a lot more focus on specialty as opposed to just doing regular primary care routine eye exams. So that's really what third year is all about. And also like low vision as well, and vision therapy, especially for the kids in the pediatric population. And in third year as well, we do have our part 1 boards exam that I'm actually starting to get a little bit nervous for because it's right around the corner for me. But the school does provide a lot of support there as well. So we have KMK, which is a program that takes you through everything that you've learned from day 1 of optometry school and condenses it into material that it's easier to go through and to fill up a lot of gaps that you missed while actually learning it. So yeah, did I miss anything for third year? I feel like, yeah, that's it.
Great job, Shelby. So students do go through a community health center at the time, one of our community health centers once they go into third year. So we have 3 community health centers that are just a bit off campus from Worcester. So one is in Framingham, one is in Milford, and one is in Worcester. So Shelby is doing some of her clinical experiences at our Worcester location, seeing some of our patients. So that just gives you more opportunities to see different patient populations close to campus there. And she did touch on our boards, which is great to mention. We've done a lot of work at trying to strengthen our board exams, and we're starting to see the fruits of our labor. So Students will participate in a board's review course as well as have access to other boards prep materials. And since the implementation of our boards review course, we've seen our part one pass rates nearly double. So that's been a really good data that we've seen come from that, and definitely promising for the future of our students. And now we are more in line with the national average in terms of our first-time test takers as of March 2024. So really great to see the progress from that itself. And then as we get into year 4, our student experience is really crescendo into their 4th year externships. And this is when they have 16-week externships that can take place all across the country. So they do need to complete one at a community health center, one at a VA facility working with veterans, and one elective of their choice where they can really go wherever they want and do whatever they want to do, such as like contact lenses or dry eyes. Something to specialize in if they want to. And our faculty members do a really great job at making sure that our students are set up to be successful with each externship they go to, and most are able to get one of their top choices at that. In addition to 4th year, students will go on to take parts 2 and 3 of the national board exam. So the university does provide a Blackboard organization with test prep materials and case questions, as well as practice exams for part 2. And then with part 3 being a practical exam, we do have a part 3 room, which we established just about like a year and a half ago, I would say, that is really identical to the equipment that the students are going to encounter when they go down to North Carolina to take that practical exam. So they'll have assignments to prepare them for the skills stations with faculty and preceptors to help them run through different practice cases. And they rotate through this room in the 3rd year, and it prepares them for the exam that they'll take in 4th year. And with the part 3 room, we've seen our pass rates increase quite significantly by 19% over recent years. So that's been great to see. In addition to that, Dr. Beach, I was wondering if you could take us through some of the other aspects of 4th year that students can expect to encounter, such as the capstone project, and the residency applications even.
Yeah. 4th year is a great time because not only you're doing your externships, some of them are one has to be in a community center, one is in a Veterans Administration, and the third one is an elective, not elective in that you don't have to do the 3rd semester of it, but you can choose what type of practice you want to go to. So, for example, if you're interested in vision therapy, you can do an externship in a vision therapy practice or pediatrics practice that specializes in vision therapy. If you're interested in cataract and refractive surgery co-management, you can go to a surgical practice with both ophthalmologists and optometrists. If you're interested in general optometry, you can go to just a general practice. So you can sort of you can really get a flavor for what you want to do when you get out. And so that's a really great opportunity that we have. And we've got, as Hannah mentioned, we've got, I believe, 32 externship sites around the country. And it's just a wonderful experience. And our students can probably tell you more about the personal experience, although these ladies don't have that experience yet. They're not in 4th year. The capstone project is a requirement of 4th year students. They have to do what is essentially a case presentation. They will take an interesting case that they've experienced and format it into a presentation, usually a poster to be presented, where they'll talk about the patient, the history, the background, the patient complaint, the findings, the diagnosis, and then talk about how the patient is going to or will have been treated. And I have to tell you, they are usually very, very interesting because of the diversity of the externships that these students go to. They see everything from trauma to cataracts to strabismus, crossed eyes, all kinds of different situations. And so the capstones are a real highlight. And the majority of students who present capstone projects also present them at professional meetings like the American Academy of Optometry or the American Optometric Association meeting. And it's great for their curriculum vitae, so when they apply for a job, the employer can see what type of experience they've had and what they've experienced. So that's really a great part. Did I cover what you wanted me to, or?
Yeah, I think that you did a good overview of that. So thank you. Would you mind sharing a little bit more about our various facilities that we have as part of the program?
MCPHS being one of the newer programs, and we've been here since 2012. We have everything. We have a very new facility. It's very fresh. You come in and it's modern, and all of our equipment is state of the art. It's something that we insist upon. All of our instrumentation is within 3 years old. We are constantly upgrading older equipment or purchasing new instrumentation. We also get the state-of-the-art new technologies. And so our patients get the benefit of the best instrumentation and equipment that is available, and our students get that experience. Everything from refractors to lasers where we teach laser surgery to our students. So it's a really excellent experience in the Eye and Vision Center here. And they also have very updated and new equipment at our community centers. For example, the Milford EMK Community Center was just opened this past year. And so, everything is, it's not like you're working with old clunky 1950s equipment like I did back in the day. So it's just a great great experience. Everything from photography to visual fields. It's just great that they come out of here with all the knowledge they need, and so they don't have to be. Their employers don't have to worry that they're not up to date on things. Oh, in addition, we do a fair amount of clinical trials here for companies that are testing new technologies. So we do clinical trials, and I'll talk about research in a moment, but our students get the benefit of using these new technologies, and also being subjects as subjects for the research. So it's great all around for everyone.
And speaking of research, I'll let you take this one too, Dr. Beisch, since you are our expert on research, if you would.
Yeah. We have an unusual approach to research here at MCPHS, whereas many schools have what are called silos. They have an academic faculty. They have the academic faculty does all the lecturing. They have a clinical faculty that does nothing but see patients. And then they have a research faculty that does their research up on the third floor and doesn't talk to anybody. And they all compete for the money, and there really is not a lot of interaction. That's sort of the way most of these schools work. And it's also how medical schools and dental schools work. The philosophy here at MCPHS is that every faculty member does research. Every faculty member does scholarship. They write in peer-reviewed journals and in professional publications. And we also work with students in research. So we invite students to work with us in our research projects. And in addition, the university has two different channels for funding for student research. So if you come up with an idea for a research project, what you do is you approach a faculty member in that area of work, and the two of you design a project, and then you submit it to the university for funding, and you can get up to, well, one of them is $4,000 and the other is $5,000. Some of that can be used for your tuition, and the rest is used for the research project itself. And that's been extremely successful. We've had students who have presented their research at professional conferences. One of our students presented at two different conferences, the American College of Rheumatology and the American Academy of Optometry. in addition to our Student Research Day, where all the students throughout the university present their research in a big forum. We also work with other institutions. We work a lot with University of Massachusetts Medical School just down the street, with one of Massachusetts' largest, I'm still learning to say Massachusetts, so one of Massachusetts's largest medical groups, Reliant Medical Group. We've just put together, we're doing a project now in our low vision facility with Harvard Medical School. And we're just, I just got off of a Zoom conference, we're putting together a research project collaborating with us as the primary investigators, but collaborating institutions are UMass, Yale, and Georgetown University. So there's a lot going on here, and we're very proud of it.
Absolutely. That's super exciting to hear about those partnerships that are coming down the pipeline. Thank you for that, Dr. Beisch. So with all of that, hopefully this sounds exciting to you and you can picture yourself here in Worcester at our MCPHS School of Optometry. So I want to now talk to you about how you can submit an application. So all of our applicants are going to apply through OptumCast directly, which is our centralized application system. So there we are going to have you send all of your official college transcripts to OptumCast. That includes, any couple of courses you've completed at a community college one random summer. So when I say all transcripts, I mean all transcripts. You're going to want to make sure that you're sending them. Otherwise, it could delay your application. In addition to that, we are going to ask for a GRE or OAT score, the OAT being the optometry admissions test. I would say this is more of the preferred exam that applicants take, although we also take the GRE. We do like the OAT because it gives you a really great breakdown of each of the individual scores based on the subject matter. So for both of those exams, we are looking for candidates to achieve a score within the 50th percentile range. We do also like to see that candidates have some experience. Although this isn't required, it is strongly encouraged just because it allows you to better speak to your passions about optometry and your interests in the field. So if you can get some shadowing experience or even working experience as a tech or an assistant, we definitely encourage you to do so. Now, you don't necessarily have to have a bachelor's degree to get into this program. I would say, actually, I think I looked at the data and it was 91% do have a bachelor's degree prior to starting the program. So with that, some people will come in with 90 plus credits as technically transfer students in a way, but it is preferred that people do complete their bachelor's degree before enrolling in the program. If you are working on any prerequisite courses as you are applying, we do need them to be completed by August 15th before you start the program. So you are welcome to apply with some courses in progress. We are going to also ask for at least one letter of recommendation, although we prefer 2 to 3. And these letters of recommendations should be professional in nature, meaning that they should come from someone who knows you maybe from an academic realm, so like a professor or an academic advisor. And a working realm is great too, so a former manager or supervisor, so that can speak to your work ethic. And if you can get one from an optometrist that you've shadowed or worked closely with, I think that's even better. If you are an international student, excluding Canadians, we will need a WES evaluation, which is from World Education Services, and they're essentially going to translate your credentials into a US equivalency. So that is a requirement for international students outside of the US and Canada. And if you meet our minimum requirements, you will be invited for an interview. We do offer both in-person and virtual interviews starting in September, typically through May/June. So some additional admission details for you. We always encourage you to apply early because our application cycle is rolling. So as we receive applications, we invite for interview and submit decisions soon after. So spots are limited and they do fill quickly. So with that, our fall of 2025 application cycle closes on May 1st. And we do judge applications by their cumulative GPA as well as their prerequisite GPA. We like to see these be at least a 3.0 or above. With that, we do take a holistic approach to the application review. So if you don't quite meet that 3.0 minimum, but have done really well on the OAT or GRE exams, we still would encourage you to apply. We do also like to see that you have an interest in the field, as you can share through your experiences, your essay, your supplemental questions, as well as the interview itself. And the timing of the application is really important. So while our application will be open through May, don't sleep on that. Make sure you submit your application early because, like I said, our spots are limited. And next, I want to touch on financial aid. So all domestic students are eligible to apply to the FAFSA. That is our school code there. I don't expect you to memorize that at this point, but if you do need to Google it in the future, it is the same for all MCPHS campuses. And we do have, for our international folks, we do have an admission counselor named Krista Levac, who works predominantly with our Canadian applicants. So if you do hail from Canada, she's a really great resource when it comes to funding and bank loans and visas and such. So I would be happy to put you in contact with her in the future if you are looking for a little bit more support as you are going through the process of applying to an American school as an international student. We do also award merit-based scholarships to all admitted students, so everyone can anticipate on receiving some sort of merit scholarship upon acceptance. They range from, I guess they are up to $12,000 a year and up to $15,000 a year for our Canadians, just to throw you guys a little bit of a bone due to the exchange rate. So that's lucky for you there. So with that, we understand that going to graduate school is a huge commitment, but we're here to help you out. So if there's something that we can do to bridge the gap, you know, if finances are a really big concern for you, and if you have a financial need, we are happy to chat. So we just want to make sure that we're awarding and rewarding our students wherever we can. So with that, as you're going through the process, feel free to discuss that further with myself, as I will be the one that is working with you all throughout the entire application process from really now until matriculation. So I'm happy to be of support when I can. And lastly, I wanted to share some contact information. So while I chat about this, now is a good time to start submitting any last questions that you might have through our Q&A box. So we're going to touch on those in a second here, but I'm also going to copy and paste this information and put it into the chat for you to take with you as well. So if you are in the Massachusetts, New England area, I'd encourage you to come visit us for a tour. Or if you want to take a special trip out here in the future, we'd be happy to show you around our campus as well. We offer tours on a pretty regular basis, but for now we do have a virtual tour available. I wouldn't say it's very robust in terms of sharing a ton of information about our optometry program, but it at least gives you an idea of how our campus is laid out. I'd actually point you towards our YouTube channels if you're looking to get more insight onto the optometry program specifically. If you go to the MCPHS admissions YouTube channel, we actually have a nice Q&A session that we filmed with some faculty members and some current students. So if you're looking for some more insight from either of those parties, those are a good place to start. And then lastly is my contact information. So if you're going to be applying soon, feel free to connect with me if you happen to have any application questions, or if you even want to meet one-on-one and discuss your individual candidacy, I do offer counselor appointments as well. So with that, we can transition things into the Q&A. So looks like one attendee is asking what is considered early for the application timeline. So now is considered early. We only just started interviewing students last week. So we had our first interview day just last week. We are still actively reviewing applications at this time. We haven't even sent out our first batch of decisions quite yet. So now is still early. Anytime really within the fall, I would say, is considered early. The spring, we'll have a lot of students want to hold off on taking their fall grades, their fall courses, and get their fall grades back before taking the OAT, especially if they're taking some core courses that fall semester. So maybe they've never taken physics before and they're taking it that fall, and they want to hold off on taking the OAT before they get that, until they get that physics grade in. So that is a really common occurrence that we see. So it is common that we'll see a lot of students hold off until early spring to apply. So while we're waiting for a couple more questions to roll in, I'd love to ask our current students that are on the call here, just out of curiosity, why did you guys ultimately choose MCPHS for your optometry studies?
Okay, I'll go. The reason I chose MCPHS, and it sounds so cliche now when I say it, and I'm sure it sounds cliche to you guys, is because of people like Hannah and Dr. Beige, who are so open and so friendly, and like, obviously, as you are an applicant in an applicant cycle, you will have applied to multiple schools. So as you interview and as you get to know the different schools, you can see the difference between schools that care about you as a student and schools that, you know, you're just kind of a name on a large roster. So MCPHS gave me that vibe that like the school cares about its students and it's doing its best to like, I was getting responses to my emails within hours, and like that's something that was like mind-blowing to me because I was waiting for weeks on emails from some other schools that I was applying to. And then when I spoke to the faculty during my interview, it was so much fun. Like we kept talking. It was a conversation. It wasn't like, you know, it wasn't like I wasn't under a spotlight or anything like that. It was just conversational, and everything just felt very open and welcoming. And yeah, that was my reason.
I love it. You give me too much credit though.
I'll just add to that. Like, I definitely 100% agree. I had similar experience with Delasha, like great admission team, and then like even the professors, just very welcoming environment throughout the process. Another reason was the class size for me because I went to University of Alberta, and that was like a huge university. So having like a small class size and having that one-to-one student professor connection, I really valued. So that was another reason. And my third reason was the great scholarship, where like the admissions team did a really great job in like communicating and just helping me throughout the process.
Oh, Shelby, you're on mute.
Sorry. I just wanted to add to what they said because I've experienced it all myself, and I share the same sentiment regarding the support that we received initially, like doing the interview. You do get a sense of community, and that you get the feel that they want to know you as a person as opposed to just another student ID number, 1002, So they actually let you feel at home, which I really loved. So that was one of the reasons why I applied.
Excellent. Thank you guys for sharing. So we are getting close to the end of the session. So if you have any last questions, now's a good time to submit them. We have one currently in the queue that we will touch on just regarding the OAT exam. So they're wondering when they should apply, if the OAT should be done before they apply. Preferably, we do like to see the OAT completed with your application, whether it's even the unofficial score. But we do have a lot of candidates that will apply a couple weeks before their planned OAT test date. So ultimately, we cannot move forward with an application until we have a test score on file. So with that, you're welcome to submit a couple of weeks in advance of your OAT exam date, but just know that we're just going to hold on to your application until we do receive your test score. So preferably, I like to advocate for not submitting your application too early ahead of time from when you take your exam. Otherwise, I'm just going to keep asking you, hey, you got your OAT exam yet? Can you move it up maybe? Otherwise, I'm just going to hang on to you. No worries. So that's just some food for thought there. But yeah, ultimately.
I didn't want to leave the impression that my answer, when I said it does not matter when you take it, it doesn't matter when you take it, as long we won't consider being on the admissions committee. We won't consider your application until we have your OAT scores. But as far as when you take it right before you submit your application, or whether you take it in advance, you can also take the GRE, by the way. Many people do. So yeah, it needs to go in with the application, your scores.
Thank you. And we have one last question, which I think I will turn over to our current students to answer. And the question is, does everyone have the same class schedule in a semester? For example, are all first-year students taking the same classes at the same times? I believe the short answer is your lectures will all line up and your labs will be slightly different given the class sizes of the labs. But do you guys want to jump ahead and answer that one?
You covered it, Hannah. It's pretty much that. So everyone's going to be taking the same classes and labs are going to be different because we can't fit over 60 people into one lab. But you're pretty much going to have it in the same day as everyone else, or yeah, just the lab schedule is different. Everything else is the same for everyone.
And also the clinic days might be different. We don't all have the same clinic day. So my clinic day might be a Monday, someone else a Tuesday. But that will stay the same for that semester, and then it will change when the following semester comes. So labs and clinic days are usually different.
Excellent. Great. Well, that clears all of our questions. So thank you everyone for contributing, both over Zoom and also via typing in the chat. I appreciate the help triaging all of those. So that concludes our session for today. Hopefully you learned a lot. Again, feel free to connect with me if you happen to have any questions along the way. And thank you again to our current students and Dr. Beish for joining us. You guys offered some really great insights that is invaluable to this presentation. So thanks for taking the time on your very busy schedule. And we hope to see everyone's application soon. Hope to hear from you. Take care. Bye.